Hello everyone. Hello everyone. I'm Anas Al Ubaidi, and the topic or the title for this session is Oncology and Hematology Documentation Practices within Chapter 32, which is about review of hematology and oncology scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Oncology and hematology are two of the most intricate and demanding specialties in medicine, dealing with the diagnosis, treatment, and management of cancers and blood disorders. These fields often involve life altering conditions, complex diagnostic pathways, multidisciplinary treatment plans, and prolonged patient care. For medical scribes, documenting oncology and hematology cases demands exceptional attention to detail and thorough understanding of the diseases, their treatments, and the associated clinical workflows. Accurate documentation is not just critical for effective medical treatment, but also serves as a legal and communication tool that ensures continuity of care. Oncology focuses on the management of malignancies such as breast cancer, lung cancer, colorectal cancer, and hematologic cancers like leukemia, lymphoma, and multiple myeloma. Documenting malignancies requires precise detailing of cancer staging. For example, TNM classification has two pathological findings, genetic and molecular profiles, and therapeutic protocols. For example, a patient with breast cancer may need documentation on estrogen receptor ER status, HER2, HER2 results, and chemotherapy regimens like ACT, adriamycin, cyclophosphamide, followed by taxane. Equally critical is capturing patient-reported symptoms like fatigue and pain, as these can signal treatment tolerability or disease progression. Hematology encompasses a broad spectrum of benign and malignant blood disorders such as anemia, sickle cell disease, hemophilia, clotting disorders, and blood cancers. Effective documentation in hematology involves capturing laboratory findings like complete blood counts, CBC, coagulation profiles, and bone marrow biopsy results. For instance, a scribe might need to document CBC, complete blood count reveals HB hemoglobin 7.4 g per dl, WBC white blood cell 3 times 10 to the power 9 per L, platelets 23,000 per UL, denoting severe pancytopenia in a patient with suspected leukemia. Tracking and transfusions, documenting side effects of treatments, and noting red flags like febrile neutropenia are all critical for superior hematology documentation. Key points. Oncology documentation essentials. Cancer staging and classification. Accurately describing cancer stages and classifications allows a clear communication of disease status and treatment planning. Key elements include TNM staging, detail the tumor size, T, lymph node involvement, N, and presence of metastasis. M. Example T2N1 MO or M0 breast cancer as of 2 centimeter tumor, one regional lymph node involved, and no distant separate, no metastasis. Histopathology reports record findings such as adenocarcinoma of colon, grade 2 differentiation, molecular markers, capture biomarkers influencing treatment such as HER2, overexpressed Ki67 at 40%, suggesting high proliferation. These details guide tailored therapies such as chemotherapy, radiation, or targeted treatments. Therapeutic regimens and their impact. Documenting cancer treatments involves chemotherapy protocols, include drug names, doses, and cycles. Example, started on fulferinox cycle 1, day 1, immunotherapy and targeted therapy, not medications like pembrolizumab or inhibitors targeting EGFR mutations. Surgical and radiation plans recorded pre or post operative details and radiation dosing schedules. Symptoms like nausea, hair loss, or neuropathy should be noted to monitor side effects and patient tolerability. Symptoms and disease progression. Scribes capture patient-reported symptoms that may indicate complications or progression. Common symptoms like weight loss, fatigue, and cachexia must be detailed, especially for advanced malignancies. Example, documentation reports worsening dyspnea during routine activities, indicating possible tumor progression in lung cancer. Treatment responses. Providing context for treatment outcomes is vital in oncology. Use terms like partial response, complete response, or progressive disease, as outlined in RECIST, RECIST, response evaluation criteria in solid tumors. Imaging results, for example, PET, PET, CT scan, not specifics such as post-treatment PET scan shows no residual metabolic activity. And here is a diagram showing the mapping of oncology progression and responses. Red flags in oncology document potential emergencies requiring provider intervention. Febrile neutropenia example accompanied by fever of 101.2 Fahrenheit degree Fahrenheit, ANC 400 periol, emergency antibiotics initiated, spinal cord compression, symptoms of paralysis or incontinence. And here is a diagram summarizing the oncology emergency scenarios. Hematology documentation essentials, complete blood count, CBC interpretation. A CBC report forms the backbone of hematology documentation, not key abnormalities. Leukocytosis or leukopenia suggest infections or marrow suppression. Anemia record types, for example, microcytic anemia with MCV less than 80 FL, likely secondary to iron infection. Thrombocytopenia or thrombocytosis focus on counts and bleeding or clotting risk. Coagulation studies monitor clotting disorders, for example, hemophilia or DIC, include PT over INR ratio, APTT, and fibrinogen levels. For example, prolonged INR 2.5 suggesting anticoagulation overdose. Specialized hematologic diagnostics. Advanced diagnostics require attention to detail. Bone marrow biopsy example, hypocellular marrow consistent with aplastic anemia. Flow cytometry identify markers in blood malignancies like CD20 positively in NHL, non-Hodgkin lymphoma. Transfusions and supportive care. Document transfusions comprehensively. Blood product type, volume transfused, and pre and post transfusion vitals. Example, 1 unit PRBC transfused, post transfusion hemoglobin increased, HB increased to 9.2 G per DL. Include treatments for conditions like iron overload or infection secondary to immunosuppression. Red flags in hematology identify urgent issues such as acute hemolytic crisis, jaundice, elevated LDH, and bilirubin reticulocytosis. Severe neutropenia document ANC to show infection vulnerability. Summary tables. We have table here on key symptoms in oncology and hematology, table on common diagnostic tests and their interpretation, table here on oncology and hematology treatment approaches, table on common conditions in oncology and hematology, table on red flags in oncology and hematology practice. And then next we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the primary purpose of documenting TNM for tumor, lymph node, and metastasis staging, TNM, in cancer patients. A, to compare side effects of treatments. B, to determine the exact location of the tumor. C, to classify the cancer based on tumor size, lymph node involvement, and metastasis. D, to evaluate the patient's genetic predisposition to cancer. Definitely the answer is C, as TNM staging is a widely accepted system that describes the extent of cancer. It provides a framework for treatment planning and prognosis based on the tumor size for T, the involvement of lymph nodes N, and the presence or absence of metastasis M. Question 2. Which laboratory or lab results would most likely be associated with septic risk in a hematology patient on chemotherapy? A. Elevated hemoglobin A as HB or HGP is 16 G per DL, absolute neutrophil count ANC of 250 per UL, INR of 1.1, or D, platelets above 200 K per UL. Definitely the answer is B. ANC as absolute neutrophil count, and neutrophil is one of the contents of the white blood cells. As a low ANC, absolute neutrophil count, less than 500 per UL, a patient signals neutropenia, and penia, low, neutropenia, low neutrophils, placing the patient at high risk for infections and sepsis. This is especially critical for hematology or oncology patients undergoing chemotherapy. Question 3. What is an example of red flag symptom requiring urgent hematology documentation? A. Weight gain over a year. B. Fever of 102 degree Fahrenheit in a patient receiving chemotherapy. C. Fatigue managed with over-the-counter supplements. Or D. Joint pain with mild swelling. Definitely it's B. As fever in a neutropenic patient common in chemotherapy, as for neutropenia, low neutrophils, so the patient will be kind of immunocompromised, susceptible to infections easily, high risk for infection, for having infections, is a medical emergency. It indicates febrile neutropenia, which could lead to severe infections and sepsis. Fatigue and weight gain are less critical, and mild joint pain is not an emergency red flag. Question 4. Which description is most appropriate or proper for documenting a bone marrow biopsy result in suspected leukemia? A. Normal morphology, no further action required. B. A presence of hypercellular marrow with more than 20%. Blasts indicative of acute myeloid leukemia, AML. C. Low erythrocyte count noted on complete blood count. Or D. High platelet volume index observed with no marrow abnormalities. So the applicable one would be B, as the presence of more than 20% blasts in hypercellular marrow is characteristic of AML, acute myeloid leukemia, a hematological malignancy. Documenting this is critical for diagnosis and treatment planning. Question 5. Why is it essential to include PET scan findings in oncology documentation? A. To monitor blood sugar levels in cancer patients. B. To detect metabolic activity in cancer separate. C. To measure platelet deficiencies in leukemia patients. Or D. To confirm hemophilia staging. It is B. The answer is B, as PET scans play a vital role in identifying metabolically active cancerous tissues, which help stage cancer and evaluate treatment responses. While imaging doesn't help with conditions like hemophilia or platelet counts, it is crucial in tracking a malignancy progression. And here we come to the end of this lecture. Thank you very much, and goodbye.